If you want to deal with depression, then at first you have to know what is depression. Depression is a disorder that is evidenced by excessive sadness, loss of interest in enjoyable things, and low motivation. Here is some physiological sign of depression. Feeling miserable. This misery is present for much of the day but may vary in its intensity. The misery lasts for weeks. Loss of interest or pleasure in usual activities. Slowed or inefficient thinking with poor concentration, leading to difficulties sorting out problems or making plans or decisions. Recurring unpleasant thoughts, particularly about being guilty, being a bad and unworthy person. Thoughts that you would be better off dead or of harming yourself in some way. Also some physical sign of depression. Loss of interest in sex. Loss of sleep despite feeling exhausted. Sleep is typically restless and unsatisfying with early morning wakening, 1 to 2 hours earlier than usual. Some people, however, may actually sleep a lot more than usual. Slowed activity and speech.
No one knows exactly what causes depression. It is clear that genetic factors are important in many cases of depression. Depression seems to run in families, as do other mood disorders, and about 30% of the predisposition for depression is due to genetic influences. A person's personality characteristics are an important factor. When people are depressed, they usually have a very negative view of themselves and the world. They do not appreciate good things, and bad things seem overwhelming. Some people have a tendency to view things this way even when they are not depressed. In other words, they may have a depressive personality style. Now we're going to talk about how to deal with depression in natural way. Number 1, get in a routine. If you're depressed, you need a routine, says Ian Cook, MD. He's a psychiatrist and director of the Depression Research and Clinic program at UCLA. Number 2, set goals. When you're depressed, you may feel like you can't accomplish anything. That makes you feel worse about yourself. To push back, set daily goals for yourself. Number 3, exercise. It temporarily boosts feel-good chemicals called endorphins. It may also have long-term benefits for people with depression. Regular exercise seems to encourage the brain to rewire itself in positive ways, Cook says. How much exercise do you need? You don't need to run marathons to get a benefit. Just walking a few times a week can help. Number 4, eat healthy. There is no magic diet that fixes depression. It's a good idea to watch what you eat, though. If depression tends to make you overeat, getting in control of your eating will help you feel better. Number 5. Get enough sleep. Depression can make it hard to get enough shut-eye, and too little sleep can make depression worse. If you follow these steps, you will get out of depression very easily. And if you like the video, please do comment, like and subscribe. Thank you.